Yes. Can I make some comments on the connection between mental health and incarceration? Um, so, uh, you know, I say this anecdotally, but I think we all know this to be true that hurting people hurt other people, right? That many of the folks in our communities all across the country have been exposed and are increasingly being exposed to violence, to abuse, to trauma at very young ages, and that exposure to trauma that is largely left unaddressed exacerbates and creates, kind of antisocial behavior that often manifests itself through criminal behavior. So part of what, again, a lot of this, we've been involved nationally since the Newtown tragedy around how do we begin to have a more constructive conversation around mental health. Now, one of the things that we just have to always appreciate is that mental health, you know, requires, in many respects, some kind of a public health space for services and counseling and all these things to really be provided. And this is why we think that the broken healthcare system, in many ways, needs a lot more repair. Certainly, it's been a very disappointing, kind of rollout for the Affordable Care Act. And I think it continues to expose all of us as a country to our inability to provide basic health services for all of us. Like, we don't believe any of us should be living in the richest country in the world and not have enough to take care of each other, right? Including making sure that if you don't have health services or health coverage, you probably will not have access to mental health services. And most folks that don't have access to mental health services, their trauma is largely then self-medicated through the use and abuse of drugs, which often, drugs and alcohol or tobacco, which often can lead then to all other kinds of antisocial behavior. So great studies done by the Center for Disease Control that you can look up that actually link the accessibility of public health and mental health services to the diminishing of incarceration rates and crime rates. So we think that, this is a very important, part of the solution. And we hope and pray that faith congregations can imagine inserting ourselves in this way, even if it does kind of push up against some of our own political sensibilities. And we think, again, that as people who read all the time of how Jesus healed folk, right? It is just so, I think, important for it never to be lost upon us that Jesus cared about our physical and mental well-being while he was here preaching. Wasn't it Jesus just went around and just told people, like, heaven is coming, and I hope everything else in your life works out, right? He fed folk. He healed folk. He spent, you know what I mean? So, how do we not just over-spiritualize what we are talking about as it relates to the life, the teachings, and the ways of Jesus, and actually live it out and make it concrete in our public spaces? So again, the Center for Disease Control, you can go to our website, lifelines2healing.org. You can go to our national organization, piconetwork.org, and you will find great resources that are grounded in faith that allow you to maybe kind of exhaust and go deeper in that.